Let's follow up another thing that also Fausto mentioned about women's care and well-being. And I am very proud to introduce to you Brian Kennedy, who is the CEO of something called GAfPA.
GAfPA.
So let's start and explain what GAfPA is.
Well, absolutely. Well, thank you, Penilla. Thank you, Matthias, and thanks to all of you for being here. This is the second year I've had the opportunity to participate here at the FOKUS Patient Conference, and I really appreciate so much what you're doing, and I think it could serve as a model to many other places, which is there's very much a focus upon how is it we bring together stakeholders across disease states to look at the common challenges we have in the healthcare system to ensure that patients can access the care that will allow for an optimal outcome, and looking beyond kind of the silos of disease states in advocacy to say where are our shared priorities and how is it we collectively raise awareness about those, and particularly awareness amongst policymakers. So I think this is a model of what good looks like, and so as GAfPA, the Global Alliance for Patient Access, we've been very proud to be a sponsor of this meeting over the past couple of years, and really hope to work with stakeholders in other places to replicate this type of program. So thank you for your leadership in that regard.
Well, thank you for coming here, and I hope also my Swedish colleagues will take the opportunity to speak with Brian, and also you have a colleague with you from GAfPA.
Cassie Dorman's back here somewhere, taking pictures.
Yeah,
yes.
she's in the back and wave, and you can meet them also outside in the coffee break. But all the way from the U.S.
Yes. So it's, bright and early.
and I mean, to start with this GAfPA and the approach of advocacy, it's a hard word to translate to Swedish. Actually.
Which, GAfPA or advocacy?
Well, I think GAfPA is easier, but advocacy is something that to be an advocate in Sweden, it's almost the same word, vet, advokat, and you represent someone. That's actually what the word means in Swedish.
Yeah.
But how would you like to explain, advocacy and I mean, access to healthcare is really, is essential, and it should be something that works in every time, whether we are in war, in crisis, and in peace time, and we need healthcare all the time. 24/7 and the global access, that's really a high ambition.
Yes.
And advocacy for that. So how do you do it, and how do you think about
well,
that?
let me start with what we mean by advocacy. So I think about my career, it's really been spent as an advocate. My background is in law, campaign politics, corporate public affairs, government relations, and now patient advocacy. And so many decades ago, I graduated from law school in the United States, and I went to work at a law firm in my community, and I represent clients. We'd take them down to the courthouse, and we would appear before a judge, we'd appear before a jury, and we would make the case, right? And you were trying to essentially set forth a narrative, kind of the set of facts, and give some meaning to it, and a way to convince a decision maker. That decision maker may be those 8, 12 people sitting in the box who are the jury, ultimately going to render a verdict, maybe a judge who is going to be ruling on a motion, but you were advocating, you were making the case. I always had an interest in public policy and politics. I wandered into that line of work, went to work for the governor of our state. I come from Iowa, which is in the middle of the country, and end up working with him in his political campaigns. And so in the political campaign, you were advocating again. But it was a very different group of decision makers. It was anybody who was going to come to the polls on election day. And you had to make the case to them. why it is that your candidate and the policies they favored were their interest, and they should make that decision that day to check the box with the candidates. You were advocating again. After that work, I found myself back, representing clients, oftentimes working with companies and other corporate actors, really making the case to policymakers. So having worked to elect policymakers, then it was about how it is you kind of convince policymakers that your client's point of view is what they should share. So if they were going to vote yes or no on a particular law, you were trying to influence that decision making. But what I increasingly kind of found in doing that was it was not so much the corporate client's point of view that would carry the day. It was the people who were going to be impacted by that decision. If they came and were either in agreement or disagreement with that, had more influence with policymakers. Mm-hmm. And so it really kind of got me intrigued with how is it you took those skills from advocacy about how to set for a discussion about the burden of the condition and the value of addressing that burden, and could reflect that. And it was really by accident I wandered into healthcare. I had met a neurologist from Vanderbilt University in Nashville, Tennessee, back in my political days, and he had spent a year on a fellowship where he worked in the United States Capitol, and he had this interest in how we could make healthcare providers, his fellow physicians, better advocates when they came to the Capitol. And so we met and we got talking, and we had kind of the idea of an organization that would train healthcare providers to be better advocates when they came to Capitol Hill, and met with members of Congress or were, making the case. Oftentimes they're very knowledgeable about the science and the evidence and really could make the medical case, but that wasn't necessarily the case that was going to prevail with a policymaker, right? How is it you talked about this in terms that were relevant to patients? So that kind of gave rise to work that we did, which was called the Alliance for Patient Access in the U.S., and that started 20 years ago. And so in 20 years' time, working with different healthcare providers, with patient groups, we really tried to advance, how it is you develop more of a patient-centered approach. Policymakers could appreciate that, and we advocate for that. But really what it comes down at the end of the day, advocacy is about two things. One, it's raising awareness, right? So who are we trying to raise awareness amongst? Well, we're trying to raise awareness amongst patients, those who are at risk for conditions, amongst healthcare providers, whether it be in primary care or specialty care, and then policymakers at the end of the day. And then ultimately, what's going to impact, making a difference on those issues impacting patient access to care are how policymakers prioritize that. And those decisions are very difficult decisions at this stage. There's competing priorities that are always out there. We are in a situation today where we're in the best of times and the worst of times for healthcare. The best of times in that innovation is delivering solutions that we never, providers nor patients would have dreamed of even a decade ago, right? But sometimes those are on the highest shelf, hardest to reach. How is it that we convince that this is these should be accessible? So best of times in terms of what innovation is, but worst of times in that there's lots of competing demands for resources. Education, we've got to educate the society. We've got to defend the society. We've got to, make investments in the technology that's going to allow us to be productive. I'm sure all these are very relevant and current themes here in Sweden and Europe and elsewhere. Policymakers have to balance all that. In making those decisions, if they are informed by the lived experience of patients and the best of the medical kind of evidence and economic evidence that we can present in a way that policymakers can utilize that in their decision making, at least it will be an informed decision at the end of the day.
And what you're telling us here is an excellent, bridge from what Fausto was telling us, that the work needs to reach the policymakers. And how we're doing it is actually essential. Because if we are well informed, who would like to advocate?
Yes.
If we are well informed and well and have the best knowledge possible, of course we can also do our job affecting the policymakers in a good way. And some people are asking us sometimes, well, why don't you have more politicians coming to your events? Do you know the answer?
Why don't you have more coming to your events?
Yeah, more politicians,
oh, yes.
more policymakers.
Yeah, exactly, yes.
And
Well, it's based on two things, right? I mean, I would think it'd be relationships. They need to know you in order to come, and they know you.
Yeah, but my answer is they are so welcome, but if we are knowledgeable enough to inform them in the right way, we don't need them to come here. We need to reach them where they are.
Right.
Isn't it so?
But we need to know what we're asking for.
Yeah,
right?
Indeed. If they don't know the reason, why something should be changed, and I of course I can tell this from my own experience, Brian, from my periods in Parliament and also in regional local politics as well for many years. I mean, it's not that you don't want to meet people. You do it all the time. But you also want to know, what can I do when I have listened to these people?
Yeah.
What can I do in my capacity?
We have to be able to answer the question, yes, I want to help. What can I do? Right? And so I think, what's interesting to me to hear the discussion yesterday in brain health and neurological conditions. Of course, what's being done in cardiovascular more broadly. I do a lot of work in kidney health through the Global Patient Alliance for Kidney Health, which we lead through GAfPA. We're all asking for the same thing, which is this early is better approach. The recognition that you can't name a condition whereby if we don't achieve an earlier diagnosis and get somebody on guideline-directed care early, we're not going to get a better outcome at a lower cost. And so you look at the Safe Heart Plan, very much an early is better approach is outlined there. It certainly applies in kidney disease. Most people aren't ever diagnosed with a chronic kidney disease until they're in late stage 4, stage 5. When they first present at that point, the only options we really have for them is dialysis and awaiting transplant. Though if we had screened earlier when they had hypertension, they had diabetes, all the leading risk factors, and concluded they were in early stages of kidney disease, we could have intervened with a pharmaceutical at much lower cost that would have had a better outcome. So I think the answer to policymakers, what does he want us to do? Well, is to allow us to act on these things earlier because it will benefit patients, it will benefit caregivers, it will benefit the healthcare system in reducing a great deal of burden on it, and it will benefit our societies as a whole, in that we'll have healthy, productive, able-bodied people who are able to contribute in ways. So what does that mean? It means that we've got to change the paradigm. For too long, our system has really been operating in these silos. And it's very much kind of, specialized silos, engaging patients in later stages of disease, dealing with acute symptoms at a point that they're harder to treat and more expensive to intervene. If we put the focus on prevention first, access to screening at earlier stages, knowing those who are at risk and doing the case finding, having the health checks, we can make a tremendous difference. And then when we identify somebody who's in an early stage of disease, get them on the guideline-directed treatments, that will have a tremendous benefit. The only way to do that is primary care, and we've got to put the emphasis there. So that's what policymakers can do, is let's shift to an early is better primary care, community care, focused care model.
So, and this new partnership then
yes.
for women's wellness,
which we're here to talk about, yes.
And the launch of that network or partnership. What can we deliver from the participants here to this network?
Well, the Partnership for Women's Wellness is a new coalition that we're launching through the Global Alliance for Patient Access. So A little bit about GAfPA. We worked with healthcare stakeholders, patient advocates, and policy-minded clinicians in different disease states to identify unmet needs that can be addressed through advocacy, raising awareness and informing policy. So, for instance, as I mentioned, we're the Secretariat to the Global Patient Alliance for Kidney Health. Last year, we launched the Global Remission Coalition, focused on the value of remission in immune-mediated inflammatory conditions, inflammatory rheumatic conditions, inflammatory skin disease, inflammatory bowel disease. We're today launching the Partnership for Women's Wellness, a coalition that at its launch is comprised of 30 different patient advocacy organizations from around the globe that are really focused on how it is that we give greater prioritization to women's wellness. And by wellness, we're really focused not on kind of what we classically think is kind of women's health issues, which oftentimes are kind of reproductive health, sexual health, cancers that only impact women. So that's kind of women's health. Women's wellness is say, what are all those chronic conditions, those NCDs, where there's a disproportionate impact upon women, right? So we heard about one yesterday in a presentation, headache and migraine is a classic case of this, whereby for too long they've been frankly ignored or undertreated, just not prioritized within the healthcare system. And if we do give a greater prioritization, particularly through early intervention, there'll be disproportionate benefit. And why is that benefit there? And I think part of it is to understand two things. One, and Professor Pinto's slides even evidence this, is that women live more years, not only just in terms of lifespan, but even more years in poor health, with a longer lifespan, but also the differences biologically that these conditions present at earlier stages oftentimes. And then secondly, that women are actually, contribute more to society in many ways. So, increasingly in most societies, women are providing as much kind we think of in terms of, jobs that they're filling and economic outcomes. But it's the uncompensated time in society that women make the much larger contribution than men. So their role as carers and caregivers, right? Whether that be for children, whether it be for parents. The value of all that is just tremendous. And if you think about the degree that their capacity to do that is undermined by chronic conditions that have been too long ignored and not prioritized within the healthcare system. So that's really the focus of the Partnership for Women's Wellness, is to say across these conditions, how is it that we make it a greater priority to diagnose women, one, to focus on prevention of these conditions, but two, to ensure that there's early stage diagnosis and access to treatment. And I think it's particularly timely time to do this, because what I increasingly see is both our healthcare providers are more apt to be women than they are men anymore. So I think it will resonate in that regard. Our patient advocates, I don't go to a patient advocacy conference where most of the seats aren't filled more by women than by men. And frankly, I noticed this in doing headache advocacy some time ago, is that increasingly your policymaker is far more likely to be a woman than a man. So I think a advocacy initiative to promote the value of early intervention that's really focused on the chronic conditions that disproportionately impact women, and there's a disproportionate value in addressing that in the context of women's wellness, is timely. Yeah.
Thank you so much, Brian. And I encourage you all to talk to Cassie and to Brian outside, and also to join this partnership.
Well, that's really my message.
Yeah?
Is we're there's no cost to join these coalitions. So whether you're
and it's also for men to join.
Oh, yeah, absolutely. Yeah. Yes, I'm an imperfect messenger for this, but yes. Please join us. Yes.
We put it into a context. Thank you so much.
Well, thank you.
And thank you for being an important part for us, FOKUS Patient, and for coming all the way from the States. And we appreciate your initiative, and I will be happy to join and to act also on what you have been talking about.
Well, thank you so much. It's great to be with you.
Thank you.